This week's video will be a deep dive into Medicare Part D. Part D is for your prescription drugs. You will need to get Part D along with original Medicare and a Medicare supplement. The alternative option to prescription drug coverage is through a Medicare Advantage plan. With an Advantage plan, you do not have to get Part D separately like you do with original Medicare. The same principles apply to the drug plans built inside Medicare Advantage. Part D is completely optional, but highly recommended, especially if you have any expensive drugs. However, if you choose not to sign up for Part D, there will be a penalty based on 1% of the national beneficiary premium, multiplied by the number of months you are not covered by Part D or by creditable coverage. The monthly premium is typically taken out of your Social Security check. Part D coverage is divided into 4 parts. Stage 1, the deductible. Stage 2, the initial coverage stage. Stage 3, the coverage gap, also known as the donut hole. Stage 4, the catastrophic coverage stage. We start with the deductible. The maximum deductible you will see in 2024 is $545. This deductible is what you owe before the insurance kicks in. During this stage, a $100 drug will cost you $100. Once you pay the deductible, your initial coverage begins. In your initial coverage stage, the copay or coinsurance is based on the drug tier your prescriptions fall into. As we mentioned in a previous video, the more expensive the drug, the higher the copay. There are generally 5 tiers. Tier 1, lowest copay for preferred generic drug. Tier 2, low copays for non-preferred generic drugs. Tier 3, medium copay for preferred brand name drugs. Tier 4, high copays for non-preferred brand name drugs. Tier 5, specialty tier for very high cost drugs. Due to federal regulation, all drug plans have something called a coverage gap, sometimes referred to as the donut hole. Unfortunately, this is not quite as delicious as it sounds. The donut hole is a temporary limit on what the drug plan will cover for drugs. You will hit the donut hole once you hit the initial coverage level of $5,030 in 2024. During this stage, the insurance company will pay only 25% of your drug. During this stage, a $100 drug will cost you about $25. This may be more or less than you were paying during the initial coverage stage. This is depending on what tier the drug is. If you have non-expensive Tier 1 drugs, it is likely you will not hit the coverage gap. And the final coverage stage is catastrophic coverage. Once you have spent $8,000 out of pocket in 2024, you are out of the coverage gap. Now you have entered catastrophic coverage, and you will only have to pay the greater of a small coinsurance of 5% or co-payment for covered drugs for the rest of the year. Come New Year's Eve and you're watching Dick Clark's Rocking New Year's Eve show, I'll be sleeping, and the ball drops, it starts all over again on January 1st, right back to the deductible. As you can see, Part D is a necessity to your Medicare needs. The link to our website is below in the description box. Please reach out to us if you have any questions. Thank you for watching.